Hi, everyone. I think we have quite a few of you here today, and I just want to say thank you for joining us and welcome to the very first Coates Community Virtual Gathering. My name is Sarah Kopak, and I'm the Executive Director of the Jack McGovern Coates Disease Foundation, and I'm so glad that you could join us today. Whether you're a patient, a parent, a doctor, or a supporter, we thank you for being here. We're thrilled that we can bring together members of the Coates community, and we hope that you get a lot out of today and you leave feeling more informed, more connected, and more supported to your community. Let's just jump right in. So we're honored to welcome three members of our Scientific Advisory Board with us today. We have Dr. Mary Elizabeth Hartnett, Dr. Layla Vajzovic, and Dr. Tom Lee. These doctors are among the world's leading experts in pediatric and retinal disease, and they've been instrumental in advancing research and care for Coates disease. They volunteer their valuable time and expertise to guide the foundation's research, and we're really lucky to have them. So very briefly, Dr. Hartnett currently serves as a member of the Board of Directors, as well as the chair of the Scientific Advisory Board at the Foundation. She's the Michael F. Marmer, MD, professor in retinal science and diseases, and is a professor of ophthalmology at Stanford University. She's also the director of pediatric retina at Stanford and principal investigator of a retinal angiogenesis laboratory. She created the first ever academic textbook on the subject, Pediatric Retina, which is in its third edition, and has proven to be an invaluable resource for residents and ophthalmologists internationally. Dr. Layla Vajzovic is a vitreoretinal surgeon and tenured associate professor of ophthalmology at Duke University School of Medicine. She is also a co-director of the Duke Pediatric Retina and Optic Nerve Center and directs the Duke Center for Artificial and Regenerative Vision. Dr. Vajzovic is passionate about research and collaborates closely with Duke biomedical engineers to develop imaging devices to improve care. She serves as a principal investigator for numerous national clinical trials in early to late stages of development and is interested in cutting-edge technologies and recovery of vision in hereditary and common retinal diseases with gene therapy, stem cell technology, and retinal implants. Dr. Lee he's earned his bachelor's degree at Johns Hopkins University and received his MD from Cornell University. He completed his ophthalmology residency at Cornell and went to Harvard Medical School as a Heed Fellow, where he studied retinal stem cells and the role they play in cancer. He completed his fellowship at the Massachusetts Eye and Ear Infirmary before returning to Cornell, where he held the St. Gauls Endowed Chair in Pediatric Retinal Diseases until he was recruited to Children's Hospital of Los Angeles. Since his arrival at Children's Hospital, he has developed the Retina Institute into a world-class center, and from 2011 through 2025, he served as the director of the Vision Center. Dr. Lee has made several advances in our understanding of pediatric retinal disease and has recruited a team of physicians and basic scientists to develop new treatments for conditions such as retinoblastoma and retinopathy of prematurity. In addition to a robust research program, he's helped create an innovative education platform to teach doctors in developing countries remotely over the internet. In 2010, he established a program in conjunction with the Armenian Eye Care Project, which deployed digital retinal cameras that allowed the US-based experts to supervise Armenian doctors during their weekly rounds on babies with blinding disease called retinopathy of prematurity, or OP. More recently, he has helped establish a neonatal nursing education program to assist the nurses who care for these children. It is his long-term goal to create an open online education platform that can be used to teach doctors and healthcare workers in developing countries and provide them with a level of expertise comparable to that of the United States. So thank you all for being here. We are very, very lucky to have you not only on our Scientific Advisory Board, but here today. So, and I know your time is very valuable. So without further ado, let's jump in. And we're going to start with early diagnosis and detection. So for the doctors, are there any specific eye exams or tests that pediatricians or school nurses could perform to help diagnose Coates disease as early as possible?
So, well, I'll probably ask my colleagues as well, but what we really want to be able to do is diagnose Coates disease before there's a problem with vision. And to do that requires either an examination or sometimes fundus imaging. But currently, what schools can do is very carefully test visual acuity between the two eyes. And if there is any difference, I think that the patient should see an ophthalmologist or eye professional to see if there's anything. It doesn't mean it's Coates disease, but just to have care. But I defer also to my colleagues. Tom, do you have any additional?
So I think there's different settings where a child could present with signs or symptoms of Coates disease. I think, the schools and oftentimes will do screening exams starting in kindergarten or first grade. And we know that the onset of Coates disease can vary, but typically it's like 5 to 7 years of age. So when the school does identify a deficit, it's important for the parents to follow up on that. The school cannot close the loop on that referral process. So if a child does have an aberration, then it's important that they get followed up. The second setting would be in their pediatrician's office, where they also do visual screenings. In the past, it's been an eye chart hung up at the end of the hallway, which is still like a great low cost, effective way to do this. If something's identified in the pediatrician's office, there's a much higher hit rate because then they can initiate the referral. They also now have some pediatrician's offices will have it looks like a camera, and it'll shine some infrared lights at the child, and it can actually identify children who have different visual issues. And so something that flashes back to the cameras being really unusual, they will flag it. And again, the pediatrician's office can initiate that. The third setting, which I think is probably one of the more common settings, is at home. When you take a flash photograph, that to me is really where there's a lot of opportunity to move the needle, because parents just need to be aware that if they see something unusual, especially like a white reflex instead of the red reflex you typically get, that they know that that's actually something to follow up, because it could be Coates disease. There's even something worse than Coates disease, which is retinoblastoma, which can mimic Coates. And so those are I think in that setting, if a person were to come up to you and say, hey, your kid has an eye problem. I think my kid might have an eye. Can you take a look at this photograph? That would be something that would trigger. One of the issues is I think some of the software now removes the red reflex and the white reflex altogether automatically. So that may become a less of an opportunity. But those are the three settings, I think, that can really provide an opportunity for the earlier diagnoses for Coates disease.
I'll just add to that, and I'm sorry, I have some background noise, so probably going to be hearing. Besides the kind of solutions mentioned, it's there's lots of work being done in fundoscopic imaging, meaning cameras that can be taking a photo of the back part of the eye as a screening tool to identify retinal conditions such as Coates and other conditions. So we are potentially using those cameras in the future in primary care settings to image the back part of the eye and diagnose it earlier. I think those technologies are definitely making its progress in, for example, endocrinology with diabetic retinopathy, and we most certainly want to introduce this in pediatric patients eventually, once we've had a little bit of better hang of all of these analyses.
Excellent, thank you. So we're going to move on to research and genetics. What scientific research is currently being conducted on Coates disease? And specifically, do any involve genetics or a specific promising area that you have seen?
Yeah, so, well, thank you for that, Sarah. And I, want to take this opportunity to acknowledge the other members of the Scientific Advisory Board who have worked very hard. We all review grants that come in, and also educational grants, which allow investigators to be able to attend meetings where sometimes they present their research, but they learn more about Coates disease and ways to manage it. So my scientific advisory board members include Mike Jumper, Tom Lee, who's here, Layla Vajzovic, who's here, Sherry Van Everen, and Franco Recchia. And it's been great to work with them. And through their help and through the generous support of JMCDF, we've been able to fund 7 investigators to do research and also to support 21 individuals to attend meetings. So I feel that we have a lot of gratitude to JMCDF. So to get to the question, though, just to speak broadly on some of the work that our investigators are doing, there's some exciting work that's being done on looking at some of the cholesterol, so some of the compounds that are in Coates disease, to try to get at what might be going on to reduce the vision in the condition. There's also some imaging studies, such as Dr. Vajzovic talked about, that would allow early potential, earlier diagnosis, even, potentially at an infant level, to determine to get treatment early and try to reduce the risk of vision loss. There's also molecular pathways, and they do involve genetics in a sense. The genetics is actually complicated, it turns out. It looks very complicated. So, hopefully in the future we'll have more studies to support that. But there are conditions that do have genetic underpinnings and that have some similarities to Coates disease. And so we're trying to learn from those situations whether or not treatments that help the genetic diseases may also, potentially impact Coates disease. So there are a number of different areas of research that are promising. And also there have been some studies that even medications that are being used for other conditions now might also have a role in Coates disease, but it's still early to know that.
So kind of going off of that, do you know of any new clinical trials or experimental therapies that are being developed or used for Coates disease? And specifically, are you aware of any that include visual restoration through stem cell or possible oral or supportive treatments?
Well, happy to take that question on. Now, there is significant work being done in inherited retinal diseases for certain, which are also rare conditions that patients get diagnosed early on in childhood because they do have genetic component. And those typically do lead to severe visual acuity loss, unfortunately. And what work is currently being done, still very much in clinical trials, is understanding whether we can replace some of the cells that have died with stem cells, with, for example, RPE stem cells, with optogenetics, kind of artificially introducing photoreceptors from algae, for example. All of these are very much in early phases of studying, but nonetheless, I think it's interesting that these are being studied for patients who've lost completely vision. I anticipate, because this is what we say, disease broad approach, not specifically targeting one disease, but it can be used for essentially any visual loss secondary to condition. This most certainly could be in the future applied to other patients, including Coates. Now, I do want to forewarn, again, these are early in investigations, but then nonetheless, there is work being done to help understand whether we can replace or supplement the areas that have unfortunately been damaged. And then secondly, retinal prostheses are also being worked on. There's what we call on the surface of the retina or subretinal prostheses that are being studied for various conditions. Again, those are also early in phases, but nonetheless, the work continues, and I most certainly hope that it's going to be approved one day for various conditions.
one of the things that we also take into consideration is that for children, so as a rule, children who develop retinal diseases oftentimes have it affect both eyes. ROP, inherited retinal diseases like retinitis pigmentosa, often present what we call bilaterally. And therefore, if the disease is bad in one eye, it's generally bad in the other also. And so the impact to visual acuity and visual function is pretty substantial. One of the aspects of Coates disease that, if you can describe as being lucky, is it's generally just one eye. And most of my patients who have Coates disease, you would actually never know that they had a visual deficit in one of their eyes because they run around the playground just like all the other kids. And I think as we start to think about treatment options, obviously we want to provide the best possible care for the affected eye. But we also have some comfort knowing that the child is going to have 20/20 vision, most likely because the other eye's fine. And so passing a driver's test or performing sports will generally be just fine. So I think as the technological advances move forward, we do take some comfort knowing that while that timeline can be unclear, in the meantime, your child has great vision. And that's what I always emphasize to parents is that your child is going to live a normal life based on the vision of the good eye. And I'll just put a plug in because I have this intense conversation with all my patients and families, the importance of wearing eyeglasses. And if they insist on playing a sport with a ball, that they wear sports goggles with a strap. And I think, although most of our conversation today is going to be around the affected eye, we should always keep front and center the fact that the most important thing you can do as a parent is not how we treat the affected eye, but how you protect the good eye in all choices in life, like whether it be sports or, just like wearing your glasses all the time. You just can't predict I tell parents that I'm sure your child's going to be very safe. I can't guarantee his friends are going to be equally considerate. And so it's just really important that as parents, you also focus on, I would say if you had to choose between focusing on rehabilitating the bad eye or protecting the good eye, you would want to protect the good eye. So just want to put that plug in.
Yeah, and I emphasize the importance of protective eyewear. And I think both Tom and Layla brought on the importance that each patient with Coates disease may present uniquely. And so the management for that individual patient can vary. And so it's always good to have a conversation with your eye care provider, the expert who's helping with Coates disease, to find out the best management strategy.
Thank you. And kind of to go on to that, Dr. Hartnett, I know that every Coates disease patient is different and that there is no cookie cutter way to treat Coates disease, but are there treatments that are currently being used that may be, experienced in more than one person?
Well, I think generally the community agrees that a common treatment is laser treatment to the abnormal sort of leaky blood vessels. So Coates disease affects the retina in the back of the eye, and the retina is the neural tissue that connects with the brain and allows us to have vision. And for the retina to function, it has to have nutrition and oxygen, and that's brought in by blood vessels. And what we know so far about Coates disease is those blood vessels can leak, and they can leak fatty substances and protein substances into the retina and detach the retina from its nutritional support and also damage it. So that's in a broad way, a way to think about it. So laser treatment to those leaky blood vessels is one form of treatment. And there's research being done to see if additional treatments, like involving injections into the eye, may also have benefit. So those are still being under consideration.
Thank you. And so I'm kind of wrapping it up. I know that there's probably a lot of other questions that are going to come up as people are listening and maybe watching this on a recording. And again, please continue to send me questions, and I'll be happy to follow up with you after the fact. But finally, this is kind of patient specific, but are you aware of any research that's being done or planned that is specific to adult onset Coats disease? Or can you tell us a little bit about adult onset Coats disease?
Happy to answer it. Yeah. I mean, in general, when I have a patient with adult onset, the treatment is very much similar to pediatric patient. In essence, we rely on recurrent laser treatments to really treat areas that are lining up, so to speak, on fluorescein angiography. And then sometimes we use injections as well to supplement that to help decrease the swelling in the retina. But regardless, once diagnosis is made, it is something that should be routinely followed. And I like to obtain fluorescein angiography for that as well to help me identify any new areas that potentially would benefit from the laser.
I have a follow-up comment to the previous question about like treatments. The treatments for Coats disease has been pretty reliable over the past, 20 plus years. I think laser, like, Dr. Hartnett talked about, has been a real anchor for all of our treatment strategies. The one thing I would comment on, I think this is where the Jack McGovern Coats Disease Foundation has played a really important role, is the effectiveness of the treatments are also dependent not just on the technology and the approach, but also on the surgeon, the doctor who's performing it. Because Coats disease is a very uncommon condition, not every doctor is as familiar with how to do it, even if they have the same laser as, let's say, I do. And I think where the foundation is really starting to make an impact is on the educational piece, where through the pediatric retina meeting that Layla and Emmy helped to oversee, doctors can come in through the support of the foundation to actually attend these meetings and really learn all the nuances of how to treat this very rare condition, because it is not a cookie cutter approach. And so the more we can educate and provide insight to these other doctors, the more effective those standard treatments become. And so I just wanted to put a plug in that all the support that the foundation is raising to help educate and train new doctors increases the success rate of all of those treatments that we currently have available.
Yes, and to reemphasize that already we've had 21 individuals attend meetings to learn about codes and management. And I think that that's very important. Also, JMCDF has the doctor directory. So I think it's valuable when you have any condition to be able to have a local expert who can provide care. And so the doctor directory is a way to raise awareness of individuals who are experts, but also local to wherever a patient is so that they can get care.
Yeah. And last thing I'm going to add, while we talked about like typical presentations in pediatric and adult patients, there definitely can be atypical presentations as well. And, we may not quite fit the bell curve, which is described in terms of age category. But nonetheless, when there are questions and maybe if it's not quite fitting, I think, again, pointing out to physician directory, it is not uncommon that I personally recommend to my patients to get a second opinion. And I definitely encourage my patients to seek that. So feel comfortable to, see another retina specialist and get opinion about seeing more, different conditions. So.
Thank you. And thank you so much to all of you for your insight, your expertise, and your dedication to not only the foundation, but to Coats patients. They're very lucky, and we are very lucky to have you. You guys volunteer your time and you support our mission, and we're very, very grateful. And we know that your work that you're doing is helping us get closer to understanding and eventually, hopefully soon, curing Coats disease.